Jazzcast Pros.
In this episode of the Doze Podcast, I sit down with Dr. Brandon Pham and Dr. Betty Nguyen, the inspiring duo behind the Medical School for Kids books. Their mission is to make health literacy accessible for children of all backgrounds. We discuss their journey from high school sweethearts to medical professionals and how they balance their careers with personal wellness and why sleep, self-care, and early education are essential for lifelong health. Whether you're a parent, teacher, or community leader, this episode offers valuable insights into inspiring future leaders in medicine and promoting wellness from an early age. You don't want to miss this engaging conversation filled with fresh perspectives about the future of health and wellness. Welcome back to the Doze Podcast. I'm your host, Soda Kuczkowski, your sleep coach and guide into the world of sleep. And today, I am thrilled to be joined by two incredibly inspiring guests, Dr. Brandon Pham and Dr. Betty Nguyen. This dynamic duo not only excels in their respective fields, ophthalmology and dermatology, but they also share a passion for education and health literacy. Dr. Brandon and Betty's journey together started in high school in Southern California. After attending college together at UCLA, their relationship blossomed, and they're now engaged with a wedding plan for May of 2025. And along the way, they've been busy creating a unique catalog of educational books for children focused on promoting health literacy, diversity, and inclusivity inspired by their nephew. Their goal is to inspire the next generation of doctors by making medical education accessible to kids from all backgrounds. We'll be diving into their inspiration for writing their books and how their personal journeys from growing up on a chicken farm to studying at top universities shape their mission. We'll also explore how they make complex health topics like the importance of sleep engaging for kids. In this episode, we'll touch on the importance of balancing personal health with busy professional lives and creative projects. We'll hear how Dr. Brandon and Dr. Betty stayed well-rested amidst wedding planning, book writing, and demanding careers. And I'll also ask them about their long-term vision for their work. You know, are digital formats or interactive tools on the horizon? And if you're curious about how sleep fits into a healthy lifestyle for kids and adults, or if you want to learn how to spark a lifelong passion for health in young minds, this episode is for you. Today's conversation is filled with insights and inspiration. So grab your tea, cozy up, and get ready to dive into a world of health literacy, wellness, and the magic of sleep. Let's get started. I cannot thank both of you enough for sitting down to talk to me because I'm really excited to talk about the extraordinary work that you guys are doing to really open up the conversation and the understanding of the different respective types of medicine to both children and adults alike. So I want to start our conversation there. Both of you are doctors, Dr. Betty, Dr. Brandon. So I want to kind of just get the backstory. Dr. Betty, let's start with you. In terms of becoming a doctor and picking the specialty that you decided, like what's the story behind there? Was there something that inspired you or made you think like, this is the type of work that I want to do? This is the career I want to go into, and this is the path I want to follow.
Yeah. So growing up, my parents were immigrants, refugees from Vietnam, and I grew up on a chicken farm. I was the first in my family to attend college and the first doctor in my family. So growing up, I had very little exposure to medicine and didn't really understand what it entailed. But as I got older and did some volunteering, I realized that I like helping people and working with other people to help them during moments of distress. So I realized that medicine was like a calling for me. And then in medical school, I gravitated towards dermatology because I love the visual nature of the field. You can see it get better, or if it doesn't get it better, you might be able to cut it out like a skin cancer. So I love that we can kind of close the loop on all of our patients and kind of either see them get better or see them through till they eventually get better.
I love that. I'm a visual learner myself, and obviously being able to see kind of the proof of your work, I'm sure is very fulfilling. And then Dr. Brandon, I know when we spoke initially, like you have a lot of enthusiasm for your field. So I'd love to hear your story.
I mean, it was similar to Betty. My parents were also Vietnamese refugees. I have three siblings. One of my older sisters ended up pursuing medicine. She ended up being the inspiration, and I followed up in her footsteps, and we just released a new book with her, Sports Medicine for Kids, and she's the co-author, and it's all comes full circle. But yeah, I mean, I was always drawn to the sort of sciences, biology, learning how life works, how our organ systems work. And so that drew me to medicine. health ultimately, I feel like is like the most important thing. And it's one of those things where you don't truly appreciate it until you lose it, or you have a sickness,
Absolutely.
or a family friend, so it's so incredibly important, and being able to understand the human body and, help others during their biggest moments of, distress, like Betty mentioned, is so meaningful and impactful. And, what more meaningful, career than to, help people with their health. And so, in medical school, I gravitated towards ophthalmology because actually very similar to dermatology, it is a visually based diagnosis tool where, we can see conditions by examining the retina. A lot of other things require like MRI, CT scans, and not really knowing
testing.
what physiology is. And so we can literally see the retina, we can see the optic nerve, and, we can diagnose cataracts just based on looking at it. And there's a combination of surgery as well as medicine, building long-term clinical, long-term relationships with patients, as opposed to other specialties where it's sort of, maybe emergency medicine, where you are saving people's lives, but you don't necessarily follow up with them. So I think it's, in dermatology and ophthalmology both share that, you're sort of experts within smaller fields. You have longitudinal patient relationships. They kind of have surgery as well as clinic. So technologically very advanced too. We have fancy lasers in both of our fields, and it's a lot of fun, and we get to, improve patients' quality of life.
Well, the smile on both of your face tells me that you love your job. In terms of different types of medicine, how did you come together to say, you know what, we should share this information, or how do we simplify this and get this more into the world? Because I think something that's really important with the series of books that you've put together is that even with adult clients, patients that I see, it's so funny how people don't even recognize the different specialties that exist within medicine itself. So like, you're really opening up that conversation. Like, people go to their primary care for everything, not even recognizing that, hey, there's a doctor that specializes in this. So tell me about that. Like, how did that come together for you guys to decide that this is a project you want to work on? This is going to be like your baby, I guess, if I should say.
One day we were reading to Brandon's nephew, who was 3 years old at the time, and we realized that there wasn't really anything quite out there that taught kids about our respective specialties, dermatology and ophthalmology. So we set out to write a book just to teach him more about what we do at work. And eventually we got to the point where we liked the book that we wrote and thought we should share it with our family and friends. So we uploaded it to Amazon, and from there, it just started gaining traction. And we started building a community of young readers from across the country, and eventually now over 20 countries, who kept requesting other specialties to get covered. But these are the books that we wish we had when we were kids. When I was even in college, I didn't know about the different specialties. I just knew about like emergency medicine, and I knew about, of course, the cardiologist and the neurologist. But I feel like the other specialties you don't get as much exposure to until you get later on in your medical training. And we wanted kids to know from an early age that different specialties out there exist, and that you can really create the life that you want in medicine.
Yeah, I couldn't say better myself. I mean, I totally agree. We really just wanted to share our knowledge that we've gained from our own respective fields, our love for medicine with children. And, we were reading dinosaur books to my nephew, and he was so smart and memorized all these different names of dinosaurs and what types of, omnivores, herbivores, carnivores. And we're like, wow, kids are so smart, and not that that's not useful information, because I think that is very useful. But what if they, also learned about how the heart works, or how the eyes work, how the skin works, or how our parts of our body work? And, that can be also very empowering for them to take ownership over the health down the line too. And, enjoy going to the doctor and asking questions and really taking care of their body, exercising, eating good foods, getting sleep. So, it sort of just took a life of its own. And, dermatology, ophthalmology, our first 2.5 years later, we just released our 31st book, and we have plans for, maybe one day to get to like 100, who knows, but it's been really a lot of fun.
How many different books do you have currently?
We have 31 distinct books. So we just released our 31st title. On average, we've probably done like one book a month. There are different medical specialties that we cover, surgical subspecialties. We cover different essential healthcare professions. So we did a Nurses for Kids book We're going to move to like a physician assistants for kids book. We're writing a firefighters for kids book. We've even expanded beyond medical specialties. So we did like a dentistry for kids book. And
I
there's
love
so many
that.
others that we have planned.
That's so amazing. And, you know, foundationally, I mean, like, as you mentioned, you guys sent me a couple of these books, and I would love to see the one where it was like, I'm going to the doctor. Like, my daughter has always been really excited to go to the dentist. And when I tell people that, they're like, that's crazy. And I'm like, well, from the very beginning, like, we always fostered her, like, it's really important to go get checkups and like made it a positive experience. And I think you're kind of rewriting the narrative around that as well, because a lot of times people are fearful to go into, you know, any type of doctor. They're like, oh, well, they figure like if they ignore it, it'll go away. Right. And you're really kind of rewriting that story to kind of simplify it for people and make them understand, like, this is why you want to look at this. This is what you need to know. Right. And you're really opening up that, like I said, that narrative. So I love that.
For sure.
Now, I do have a bias because obviously you wrote one for sleep medicine for kids, but can I just tell you, my favorite book is this one right here.
Oh, that's
Good Night, Little Doctor. Now, can I tell you why I love this book?
Why?
Now, when you and I, you know, all of us got on our initial conversation, you know, I talked about this because both of you obviously are going through right now your residencies, you're finishing up. And one of the biggest things, especially now, you know, here I live in New York and there was like a strike. It's a huge area of contention because the long hours that you work and the type of, like, the lack of emphasis on the importance of sleep. And I open up this adorable little book with beautiful illustrations. And the first thing it says is, good night, little doctor. It's time for you to rest. All doctors need sleep to perform at their best. And it is the messaging. I mean, I am all about, you know, using sleep to unlock your untapped potential, but this speaks volumes and I love it. So my question to you on this book then, what is it like in terms of like your own sleep? Because I mean, you're in it right now, right? You're working the long hours, you're doing all this. How does sleep fit into that dynamic for you?
Oh, sleep is so important. And that's why we love the work that you do, bringing awareness and promotion about good sleep habits and good sleep hygiene, because we think that every kid and every family out there should be getting good sleep every night.
For sure. As residents, it's much more difficult to get that full 8-9 hours of sleep. You know, we have call and, you know, Betty's been on call, you know, every other week. And, you know, she holds a pager overnight and sleep is interrupted. And, you know, there's a big difference in, you know, our moods and our energy levels when we don't get, you know,
the way you show up in the world. Yeah.
You know, night's sleep. And, you know, it's just the nature of our training. It's part of the sacrifice that we make to, you know, go through medicine. Generally, the call responsibilities change with time, where early on during our residency, we're working sort of the hours that older senior doctors don't want to necessarily work, the days of the week that, you know, that they aren't working, weekends and things like that. So it's definitely, you know, I feel like before medicine and before residency, I sort of took sleep for granted and took my weekends off for granted. And now whenever we have 2 days in a row off, it's like, that's a golden weekend. But I mean, for most of the world, it's just like a normal weekend. Even at night, you know, when I spent, you know, my first year and I was constantly on call and I was switching back and forth between days and nights and my circadian rhythm was off. I mean, I just didn't feel in the right, like, mental space. You know, even if I was getting, you know, 8 hours on average every 24-hour period, if it wasn't in an uninterrupted fashion, or if it wasn't the same 8 hours, you know, from like 10 p.m. to 6 a.m., but if it was shifted during the day, it just wasn't, you know, great sleep. And it made me appreciate just how important that sleep is on a daily basis that most of the world probably takes for granted unless they are, you know, on shift work or on call and things like that. So, I mean, it's incredibly important. And I mean, you can't survive without sleep. So, and
that's what I love about this next generation. Cause I mean, I've been in sleep since 2007 now, I think it was. And how much, I mean, sleep is in its infancy, right? It's the baby of all the different specialties the last 60 years. But even people understanding, like, I mean, you could write a book on sleep hygiene. I mean, I remember a time when I would say sleep hygiene and people were like, what is that? Like taking a shower before bed? I don't understand. Like, what do you mean sleep? Like, what is that? What is that terminology? A lot of these things are a lot more mainstream. Like you talk about circadian rhythm. People had no idea what those things were. So like when I read your sleep medicine for kids book and I gave this to my daughter, okay, she's 10 years old. she saw it on the desk and she's like, what is this book? And I said, oh, I left that for you. I said, I'm going to be interviewing these two doctors. These are a series of books that they wrote. They wrote one on sleep. I want you to take a look at it. I want you to tell me what you think. She starts screaming from the other room. She's like, this is amazing. And I'm like, what's amazing? She's like, I'm reading this book. She's like, I love the drawings in here. I love what it says. And I was like, and I had read it previously. So I'm looking through and I'm like, she's in 5th grade. She's 10. She won't be 11 till April. And I'm like, some of the words in here, I'm like, I'm wondering like, is this at her level? Will she get it? Will I have to like explain anything? And she's like, oh, the brainwave. She's like, you don't tell me any of this stuff. And I was like, you want to know about this stuff? And she's like, yes, Mom, like you should talk more about this stuff. And I was like, well, because when I give her books, it's all, I try to avoid the ones that create this perpetual negative association with sleep, like kids should be afraid of the dark. I know they do it so that kids aren't afraid of the dark, but a lot of times it actually creates these negative emotions around it. But a lot of the bedtime books don't have to do with like the education. Like from the very beginning, she knows like rest is important, sleep is important, especially to her recovery. So, I mean, she's got, a strict bedtime. She makes sure that she gets her, 10, 11 hours at night, depending on what her sports are doing. But it was great to see her be like, oh, well, you talk about melatonin, but like, you didn't tell me that it was like a hormone. And I was like, well, do you even know what a hormone is? And she's like, well, you could tell me. And I was like, I didn't know that you would be interested. So it's like, it opened up my eyes as well, because I mean, I talked to her about the importance of sleep. I say, it helps you focus. It's going to help you be a better athlete. It's going to help you be a better student. And I talk about the benefits. And I guess being in kind of the clinical end and then moving into the public health sector as a sleep health educator, I've always tried to really simplify it, because I mean, people really just get kind of, what's a circadian rhythm? They get super confused, and I try to simplify it. But our little ones, their minds are just like you said. I mean, she didn't even question that. She's like, well, just explain it to me more. Like most people are like, well, can you simplify it? Or like, what's that? Or they kind of like, I guess as adults, we tend to kind of brush off what we don't know. If it doesn't really pique our interest, we kind of push it off to the side. But kids are like, tell me more. So I absolutely love that you wrote this book. And she gave it like 2 thumbs up. She was very, very excited to read it.
That warms our hearts. That's so amazing. Yeah. And that's something we consciously try to do. We try not to oversimplify things. We don't water down concepts. I mean, we don't shy away from using accurate medical and anatomic, terminology, and teaching kids about different brain, like waves and big words. We don't shy away from it. We have a pronunciation guide at the end. And because kids are so smart, and, if we just keep oversimplifying things, they're not teaching them the accurate medical terms and diagnoses and treatments, then they won't learn it. And I don't think we should ever underestimate how smart children are.
Absolutely. I show this to my husband and he's like, well, what is that? Is that a ECG? Is that an EKG? I'm like, no, that's an EEG. I'm like, he's like, they don't put that in there. And I'm like, well, I kind of feel like it's on purpose, because most people use like the acronym, but they don't even recognize like there is a much longer name for these tests and what they do. So I appreciated that. So it was like just to see the distinction between like his reaction to it and her reaction to it were completely different. So I love that.
Absolutely. No, we appreciate it. Thank you for that feedback. It's very warming to hear.
It's interesting to see how an adult reacts versus a child acts. And then being someone who's in the field and always being told like, you have to simplify. Like, I don't even talk about the fact that melatonin, like I said, is a hormone, because a lot of times, like you talk about hormones, you talk about neurotransmitters, people just, the blinders go on. They don't want to know that. They want to know like, what's the quickest way? And I'm like, well, don't buy it at Target. Use natural light. Like I try to tell them like the easiest way to go about it without having to get into all the science and the specifics, and really kind of simplify it. But in terms of the books that you have, I know that you said you're in 20 different countries. Are they also in different languages?
Yeah, so we are working with a local company here to translate all of our books into Haitian Creole. And one of our books, Psychiatry for Kids, is also currently available in Spanish. Our goal is to eventually get these books translated to multiple different languages, but currently we're just focused on writing new books to cover more specialties. And I think in the near future, we'll start pivoting towards translating and trying to get our books into as many hands as possible.
Yeah. Yeah,
so one day it'll be like, oh, I met them. And now they have like 5,000 books. And I'm like, I met them when they just published their 31st.
Yeah. Yeah, I mean, right now, we're both working full-time jobs. We're like every month we're pumping out a new book. So a lot of these things, I mean, these are opportunities that people just have like reached out to us, and there's a lot of people who've offered to translate our books to different languages. And one was a local Miami-based company that does healthcare related books and translations to Haitian Creole, and there's a big Haitian Creole community in Miami. So they reached out, and we partner with them, and then we had one psychiatry resident who works closely with our collaborator, Jake Goodman, who did Psychiatry for Kids with us, who offered to translate the Psychiatry for Kids book. So, I'm sure there will be many opportunities online. There's so many more languages. We want this to be accessible everywhere, regardless of language, regardless of country. And, we already have this book, sold in, over 20 countries, and, definitely getting it translated to more languages is definitely something we hope to do in the future.
I love that. And in terms of the providers that you're working with in order to, kind of script all of these, are these individuals that you've worked with? Are these professors? Are these other doctors within the hospitals? Like, how are you getting in touch with all the different kind of specialties?
Some of them are colleagues, for example, ENT for kids, ear, nose, and throat surgery for kids, which we recently published right before our sports medicine for kids book, was with one of Betty's prior medical school classmates, who's now an ENT resident physician at Ohio State. The sports medicine for kids book I wrote with my sister, who is 8 years older than me and read to me when she was 12 and when I was 4, and taught me how to read and inspired me to learn and eventually become a physician. And so in a way, we actually have her to thank for this entire medical school for kids book series, which is really incredible. And, otherwise, many are sort of like, I wrote, with my prior medical school classmates, Dana Leonard, orthopedic surgery for kids with Betty. And, some are classmates, some are co-residents, some are friends, family, and, other people who we worked with. So we're always looking for collaborations too. And, it's always great to collaborate with people in these other subspecialties, because then it's a learning experience for all of us. They get to partake in a book writing process, which they may not have experience with. And we're learning about the field, and, it's definitely a lot of fun. And then kids ultimately benefit from it.
I love that. And do you have like a focus group that you use your nieces and nephews as like the focus group for your books? You have them read them first?
A lot of times we'll go back to California and read to them and get their feedback. And,
initially, his nephews and nieces were the focus group. And now the community has grown so wide that every time we publish a new book, the next day we might see it on Instagram, and a kid and a parent might post about it or share some feedback about it. So we love hearing from these young readers and families from across the world. And if anyone ever picks up a copy of our book, please feel free to reach out and give us feedback, because we love hearing and seeing these photos and videos.
In terms of, I know you guys said that you have lots of plans for lots of books, but this on its own, because you're now supplying these types of books to schools, to communities. That is a business and a project on its own, right? That could take on its own kind of wheels, if I may. What do you see for the bigger picture for this? Because I know that like you're looking at writing continuous books, but in terms of like as a company, how do you see the kind of the trajectory of how this will go in terms of how these books are used, or what's kind of like down the road that you're looking at?
We definitely want to make these books as accessible as possible to as wide of an audience as possible. And, we realize that even though our, books are sold on Amazon and bookstores, that doesn't necessarily mean they're accessible to everybody, especially the people, for example, our Hooray, I See the Doctor Today. We want this to be in the hands of children whose family, may not have great health literacy, or families who, maybe don't have much trust to going to the doctors, or don't see the importance of going to the doctors. Children in underserved communities or underrepresented backgrounds. And we understand that there's limitations to, when something is sold, online, someone has to, go out and seek it and then buy it. And so, actually, and what we've done recently is partner with certain hospitals. A lot of times it's just hospitals will reach out to us. They'll find our books. And, just recently we had a hospital reach out, and, we worked with them to supply a large number of books to children in need in underserved areas. And, it was our Hooray, I See the Doctor Today book. And
which, by the way, not to interrupt you, but I think that should be required reading starting in like pre-K or kindergarten. I'm not kidding. It should be like a required reading book because especially if, like you're saying, like the health literacy or people even don't recognize the importance of from the very beginning, like you need to constantly be aware of your health. If you're not feeling well, like what healthy looks like. I mean, even going, I know you said you're expanding into other areas. I would assume that like nutrition, like food is medicine, right? Like that's a whole other sector where helping people understand the things that actually are important and that actually the puzzle pieces that make up good health.
Yeah. Yeah. And that's what we want to, we want to be in schools. We want to be in libraries and, our Hooray, I See the Doctor today, teaches kids about the importance of health, vaccinations, going to the doctor, and it celebrates going to the doctor. It's not like it's a scary thing. It's like, hooray, I see the doctor today. So it's like from an early age, they have we want it to be associated with good feelings. And, even one of the, we were just speaking with one of these representatives at this nonprofit, and she even said, like, I've never seen a book like this before. And it also celebrates diversity. You had a male nurse and a person of color, a female as the doctor. And, it promotes this sense of like, there's no boundaries. And it was just so touching to hear. And, they had gone through so many different books about doctor's visits. And we're like, literally, this is by far the best one we could find. And this is how many copies we want, and we want to distribute to all these. It was incredible. It was like really touching to hear that firsthand. So
no, absolutely, that's so great to hear, and I get that because visually, like you said, seeing yourself in photos or seeing the different possibilities or things that you didn't necessarily like. Believe it or not, right? The stigmas that still go along with, there's a male nurse, or, you know what I mean? In terms of like gender going along with different roles. So it's great to be able for kids to be able to see that visually, seeing themselves. I know that's really important when I buy dolls or I buy books for my daughter and she's always like, she looks like me. She looks like me. And that really does make a difference because a Latina, she's like, my skin is a little bit darker than my friend's skins, right? So it's important for her to see that representation and to see, everything that she's capable of doing. So I really appreciate the work that you're doing.
Thank you. Very kind.
To close out, if I could ask you a question. So in terms of inspiring this next generation, obviously these books are a great gateway for that and kind of changing the narrative and kind of opening their eyes. But I'm sure you guys are well aware of the fact that we have a bit of a healthcare professional shortage, right? Across all of the different fields. What would you say to someone who's listening, whether they are a teacher or a community leader or a parent, to kind of really re-engage our little ones in terms of entering this type of profession?
I think representation is so important for kids to have exposure to content where they're seeing people who look like them in these certain professional roles. And having exposure at an early age is important. So having, just teaching kids about the different options out there, about the different types of healthcare professions.
Yeah, I completely agree. I think kids don't know what they're not exposed to. And I will say, I wouldn't choose another field. One, I would go, if I were to go back in time, I would choose medicine again 1,000 times. I would choose my specialty 1,000 times. Every day we go to work and we're able to improve the quality of life of others. And, we have friends in different fields and, maybe they go into work and they, look at a computer for 8 hours or they sit in a cubicle and, in their coding or whatever it is. And there's so many different jobs. And I feel like a lot of people go to work and they treat it's like an 8-hour thing where it's not their life. And then they live for their 8 hours of the day, not at work. But, choose a profession where you are motivated. You wake up in the morning, you're excited to go to work and you're excited to see the difference that you make in the lives of others. And I don't think there's a better career out there than, a career in medicine where you constantly get to improve the lives of patients in a manner that is so incredibly meaningful and ultimately, what is more important than someone's health, I can't think of anything more important than that. So
and the field of medicine is so large. I agree with everything Brandon says, but you can really make what you want of the field. So if you want to work with patients like one-on-one and spend a lot of time with them, there's fields for that, like internal medicine. If you don't want to see patients at all, you can go into pathology or radiology and have zero patient interaction. If you want to be in a hospital full-time, you could do that. If you want to work one day a week, you could also do that. If you want to work from home reading pathology or radiology slides, you can also do that. So you can really build the life that you want, the schedule that you want, and the types of patients that you want to see, the diseases you want to work with. I think there's so much room in medicine for any personality and any type, that any person who just wants to help other people. And I also will say that I never expected to be like a doctor / entrepreneur / author. And I think there's so much possibility. You don't have to like pigeonhole yourself into one field. You could really dabble into everything that you're interested in. And I think since we started writing these books, we've come across other medical students or physicians who are also entrepreneurs or artists or authors. Some have even started their own like media companies and have only worked in medicine part-time, like 1 or 2 days a week, and now spend the rest of their time like creating videos or creating content or creating animations. So there's really a lot of things you can do with a medical background, including becoming a doctor, but not limited to that.
Yeah, and there's so many of those subspecialties. I mean, even with the certification program that I did for sleep coaching, I was always like, well, who is it that you want to help? Because like sleep is a very big field, right? And it's like, do you want to help women who are menopausal? Do you want to help teenagers, like circadian rhythm disorders? Like there's so many different things, not just in sleep, in all of the respective fields that you can niche down and help different demographics. Because I think that's one of the things is our healthcare system is so disconnected, which I guess that could be like your Christmas promo, guys. You could put a puzzle together with all the different pieces of all the different specialties. And that could be like the Christmas gift that comes along with the book. But I think that's the thing, is connecting all of those pieces and helping people understand that health is holistic, right? There are so many parts. There's so much that we still don't know. And everything that you just shared with me, I think you wrote just like another entire like volume of books when you're talking about pathology. Like there really is. Like if you think about, if you could take just one sector of medicine, I mean, you can really dissect so many different parts of health and wellness and medicine in general. So, I mean, like I said, you guys are doing amazing work. I'm so grateful that Jonathan put us in contact with one another and that I was able to share a little bit about this. And I definitely in my school programs will be talking up your books and hopefully getting some of this. Like I said, I'm completely serious about it being required reading. I absolutely love the idea of helping people understand that going to the doctor is not a scary thing and that from the very beginning, it's something that we should be open to. So thank you for the work that you're doing.
That's so kind of you. Thank you so much for all the work that you do too. And we're excited to, see what comes of this. And, thank you for having us. And as more of our books come through, we'd love to send, our next installment of whatever, subspecialty or book that we have.
Well, I'm definitely going to be keeping tabs on everything. I'm going to have it like bookmark. Every time something releases, I'm going to get a notification about you guys now. Because like I said, sleep is connected to everything and everything that you're doing. I mean, people like to say I'm a connector, right? If I know that someone should have this, or you should be in contact with someone, I'm absolutely going to make that connection because I want more people to have the right information, the education, and the resources in their hands. And a lot of times that's one of the things that's missing is people just don't know where to look. And the fact that you have this and you've brought this project into the world, more people need to know about this. So thank you so much again.
Of course. Thank you. Thank you so much.
Thanks for tuning in to the Dose Podcast with a Z. If this conversation resonated with you, share it with someone else who could benefit from it. And if you've got a story or an idea to share, I would love to hear from you. So drop it in the comments below. Until next time, sleep well.